Good morning. This is the fifth edition of Skillsforce Career Talks. Today, I have a very close friend of mine, Dr. Vasanth. Um, Good morning, Vasanth,
Good
and
morning, Ganesh ji. Good morning.
welcome to this Career Talks. And I'll just introduce you a bit. There is a lot to talk about you, so give me a minute. So, Dr. Vasanth is a BDS dentist from he has got his BDS degree from MGR University in Tamil Nadu in the year 2009, and he started his clinic, which is called Sri Sai Baba Dental Care. He also owns another clinic called Eden Dental and Aesthetics, where they do a lot of dental procedures. Um, he runs an academy called Eden Academy of Advanced Dentistry, where he and his wife, who is also a dentist, they train doctors and students in technical skills and management. So hospital, dental, all these also require a lot of management skills. So Dr. Vasanth and his wife, Dr. Alice, they do this. They started Eden Academy in the year 2020. Um, he, Dr. Vasanth has worked in SRM Dental College as a faculty, so he has a lot of training experience, and he has received multiple awards. Global Achievers, Seva Ratna Award for professional, and he is also, um, he's not only working as a profession, but he and his wife also have a social work instinct. So they have started Morning Star Educational and Charitable Trust, where they do free medical camps for the underprivileged. They have done 5, 6 camps so far. They are looking at providing free treatment for 100 patients from old age homes. And they are also planning to go to schools and provide dental services and awareness. So, Dr. Vasant, very warm welcome to this career talk. People
Thank
now
you
know
so
about you,
much.
know about
Thank you
you.
so much.
So, before we start into this, I want to give our students who are going to watch this a brief about what is BDS. BDS is Bachelor's in Dental Surgery, and as usual, a lot of people know about medicine, MBBS, but more than 22 lakh candidates take the NEET exam every year, of which around 11 lakh students manage to qualify for the test. So it's a 50% approximately. As per data of the Dental Council of India, total of 48,000 odd BDS seats are available for admissions throughout India. After MBBS, BDS is the most sought after course opted by science student. So if you're done 12th science, you are eligible for taking NEET. And the second option after MBBS is BDS. Admission to these dental colleges for Bachelor of Dental Surgery, BDS, will be done through the NEET exam, which is National Eligibility Cum Entrance Test. The Dental Council of India, DCI, is the authority to regularize the BDS admissions in India. I'll just name a couple of top dental colleges in India, which are being ranked by National Institute Ranking Framework, NIRF. So students who want to see which are the best colleges, please visit NIRF website, and you can always check which is the best college. So some of them are Savita Institute of Medical and Technical Sciences, Chennai. That's number one. Manipal College of Dental Sciences, Manipal, Karnataka, number two. Number three is DY Patil Vidyapeeth, Pune. Four is Maulana Azad Institute of Dental Sciences, Delhi. AB Shetty Memorial Institute of Dental Sciences, Mangalore, 5. And 6 is SRM Dental College, Chennai. 7 is Ramchandra Institute of Higher Education and Research, Chennai. Manipal College of Dental Sciences, Mangalore. Siksha Anushasan, Bhubaneswar. Jamia Millia Islamia, New Delhi is ranked 10. So you can look at other colleges as well from the NIRF website. So coming back to our guest here, not to keep him waiting a lot. He's very busy. His phone is constantly buzzing. I had a very tough time to get him for this interview. So, Dr. Vasanth, um, why did you choose BDS? What inspired you?
Yes. Yeah, first of all, Ganesh ji, thank you for this wonderful opportunity you have provided in exhibiting my profession, my career, as well as uh, my dream journey in a short period.
Yeah.
Thank you so much for that.
Yeah.
Initially, I'm a person who is interested in artworks,
Hmm.
artistic things. I like drawings. I
Hmm.
like paintings. Even though I'm not good at it, I like to do it.
Yeah.
So that was the thing that made me give some interest in dentistry. Apart from this, technically also, you don't have to work day and night completely.
Right.
There is no night shifts. You
Hmm.
can schedule your appointments. You can schedule your day professionally, and so
Yeah.
I don't have to compromise or sacrifice most of your nights
Yeah.
from health, doing your health. So that is the most important thing. I felt that dentistry would be suitable for me, and healing people, getting them better is one great opportunity, and it's a blessing actually. So that
Right.
was the thing that made me choose this
Awesome,
profession.
awesome. So how did you, I mean, you went into MGR University and did your BDS. Was your family supportive of it, or they wanted you to do something? Where did you face any hurdles in the college while studying?
Yes, when in the beginning, like from my school days, my parents were motivating me to become a doctor. That was the whole interest, and I've been fed in my mind and trained mentally also to become a doctor.
Okay.
And I was waiting for the counselings,
Mm.
and during the counseling, first counseling, I couldn't get the
Mm.
with
Yeah.
college actually.
Yeah.
So I waited few months. During the time period, I have to join another college. I don't want to
Mm.
mention the college name, but I joined an engineering college, joined in Triple E, and I was almost okay, but I'm not. Something was bothering me that I should become a doctor. My father and mother both were like upset because I couldn't join and become a doctor. I told them like, I'll give you hope. Don't worry. I'll do PhD and I'll become a doctor. That was the
Awesome.
thing I told them. And fortunately, within a month, I got a second counseling invitation, and I attended the counseling. And through counseling, I joined this MGR University College,
Very
and
good.
the journey went well. And initially, when the college was we joined the college. The subject was very new to us because it is
Mm.
totally technical, and also it involves all kind of physical, physiological,
Mm.
and also hand skills are more important because
Correct.
it takes 50% of your study part and 50% of your hand skills. So daily we used to have labs where we have to go and perform some minute things like what cubes we have to do with the plaster of Paris. We used to have
Yeah.
the dental stone things, and we have to do. We are initially the whole first year will be like training our fingers and hands and orienting our mind towards that hand skills. So that was
Correct.
the first complete year we were doing it. And second year onwards, we have given slowly into treatment part in the dummy things.
Okay.
So since I like to do all these things. Initially, it was for 6 months it was little tough,
Mm.
and after that, when I started liking doing likeness in doing it, then it came automatically.
Mm.
We say practice makes anybody perfect, right?
Absolutely.
So we have to keep doing it repeatedly. We were why they're asking us to do 8 cubes, 10 cubes continuously, the same size, the same dimensions. We didn't know, but
Mm.
they want us to handle them in a right way. That was
Correct, correct, correct. So for students listening, right? So dentistry, our teeth are made out of calcium, right? It's not skin and all that stuff.
yes,
It is an element that you have to work on, which is connected with very delicate nerves. That is the reason when you have a problem with your teeth, it is very painful, right?
yes, very
So the dentists are really artists who can do sculpting of your calcium based teeth, also take care that it doesn't give you more pain. So they need to know a little bit of anesthesia where they make the area, numb,
Now,
so it is not painful. And then they have to use tools which will dig into your jawline and pull out the bad teeth and do root canaling. Oh, it is a terrific process. And I have seen dentists myself, I have been through certain procedures. I've seen dentists putting a lot of effort to do that, and very delicately, very gently, so that the patient is not having a lot of pain. So that's great. And that is the first part, right? We all, as humans, we all work for one motive or two, right? Everyone works to fill their stomach, and you
yes,
can
very
only fill your stomach through your mouth,
yes.
right?
This is
And
very
the entry point of your mouth is your teeth. You have to crush. It has to be good. You have
yes.
to,
Your digestion begins from your
yeah,
mouth.
exactly,
That's what.
exactly. So they are the gatekeepers of our entry point into our well-being. So dental doctors are really great, though they give us, bring us to multiple sessions and all. It is all for our good. So, Dr. Vasant, what kind of advice would you give to people, students who are appearing for NEET, and what kind of plan they should have? When should they choose for BDS? If they're not getting MBBS, what are the options that they have?
What I would suggest is you should be mentally ready to
Hmm,
accept it.
correct.
Because being a faculty in a college, I worked in few years.
Yeah,
There are so many students coming directly from the schooling with the mindset that I didn't couldn't get join MBBS, so I am joining this. They
right.
felt like they were like cornered, so that they were nowhere to go.
Yeah,
And developing an interest, it itself will take a lot of time. So
right.
what I would suggest is you should know one thing, like it's nowhere different from any doctors
Correct.
BDS. It is totally kept separately because the importance of the subject is so essential.
Right.
That is why the whole body completely is given as MBBS, and only the teeth and jaw and face is completely given as a BDS. And all over the world, it is the same. So
Yeah,
the dental element is totally handled by separate doctors because the importance of, and it is totally depends upon the treatments and skills. It is
correct.
not just we cannot medicines to the very little extent only to help. So your skill, your hand skills, your treatments, that is what is going to be helpful for the patients. So you should be mentally prepared for that.
Yeah, yeah. So I'll use an example, right, to compare MBBS with BDS. Okay, so if you're doing MBBS, right, you will spend around 5 years, 5.5 years to get the bachelor's degree in medicine. You cannot be employable directly in the current scenario, right? No one will come to just a MBBS doctor. They want to go to a super specialty kind of a guy. So MBBS students, after 5.5 years, they have to go for PG, where they spend 2 years to get a PG in medicine. That is also not satisfactory. If you want to start your own practice, you have to do a 2 year specialization, which gives you an MD degree, and then you become a super specialty doctor, which will, let's assume, right, you earn around 30 lakhs per month. Okay, I'm giving a very high figure here. um, but if you are doing a BDS, if you have done a BDS, you don't need to go through super specialty and all immediately to make at least 20 to 30 lakhs if you're a very good dentist, you can easily make that. So it is a shortcut where you can become more, start earning your income very soon. So BDS is required. What a cardiologist or orthopedic doctor starts making enough money can be achieved by a BDS immediately after his college. So that's the kind of difference. The age, the time, the effort taken is much faster. We need BDS doctors. It's every part or organ of our body has a specialty, and teeth are what not only teeth, the jawline. A lot of progress has been made in dental science. That's why they have aesthetics. So I'll ask Dr. Vasan, what is dental aesthetics?
It is all about totally transforming a person's smile.
Mm,
Because a smile can define a person's
mm,
look, aesthetic, and
mm.
as well as the confident level of the person depends upon how good they smile.
Yeah.
Because nowadays, even the kids, the teenagers are much conscious about their
Oh
looks.
my God. Oh my God.
So
So
it's
you
actually
get a lot
interesting.
of youngsters telling you to improve their smile.
Yeah, really, really. They're looking for even the age of 12, 13, they're telling that my teeth are not fine. Can you do
Mm,
something? And
yeah.
they insist instead of parents insisting the kids to come to the clinic, they
Yeah.
themselves voluntarily, because they see their colleagues, I
Mm,
mean, like their classmates undergoing treatments. So they
right.
want to consult with the dentist and find out whether they can become better.
Yeah. Yeah. Yeah.
So a
It's
lot,
yeah. Go ahead.
yes.
Sorry.
There are a lot of celebrities without we don't know, but there are a lot of celebrities that they have undergone treatments and transformed their career into a wonderful thing. So if
Wow.
you go Google it, there's about the celebrity undergone treatments. There are so many things, but it is like you into a different person. That is what aesthetic actually means. So
Okay.
if the person is missing or malaligned teeth or anything, whatever it is, we can totally design it into a completely thing, because the lips, everything, the mouth, jaw, everything is over the kept over the tooth. So if
Correct.
it is aligned properly, the face dimension itself it changes.
Correct.
So that's
Correct.
how it helps.
Right, right, right. A very important point that you mentioned. So you need to look better. You are in a professional field where your face value is important. Then definitely people will go for improvement and look better, and also bring a great smile. So that's awesome. So Dr. Vasant, in your clinic, in your typical clinic, right? What are the other experts that surround you? What kind of people are required in a
We, actually, as a dentist, not just in my clinic, in the whole uh, dental world,
Mhm.
there are so many dental associated fields that are working.
Right.
In the clinic, where there are dental assistants,
Mm,
we have dental assistants, we have dietitians, we have
mm,
um, hygienists, dental hygienists. So
mhm.
there are courses for that, and they
Mm.
can go for the course, and they can choose this.
So,
So all those things can be
so these
achieved.
are all bachelor's courses or diploma as well?
It's their diploma courses. They can be
Diploma
achieved,
courses. So after
and there are
12th,
so many academies that also train them, because they have whatever we do with there. If there is a very proper training, they
mm,
can excel well, and they can shine in any field. Right? There is nothing like only this
absolutely.
field should be smart enough, and other fields and that can manage. Nothing like that. Every field. I used to say our doctors, like whatever you do, you do simple thing. You can do it in the better way or in the best way. Choose the
Correct.
best way to stand
Yes,
out of the crowd. So
absolutely.
that is what a skill is more essential.
Great advice. And you
And
do
apart
have,
from,
yeah,
yes,
yeah, yeah. Go
I,
ahead.
I answer you that. There are lab technicians
Right.
who make the materials for our clinics. So
Correct.
they work in different laboratories. Companies, they own the laboratories, and they have individual labs also. From
Mm,
there, they manufacture the crowns and other
yes.
aligners and all those things, and they can deliver to us. So that way also they can do business associated with the dental. And dental supply, dental machinery equipments are this one ocean.
Correct. Correct.
That is medical equipments, dental equipments totally is a different ocean, and there are so many people involved in that. And nowadays, they manufacture in India. There are a lot of instruments are, and also imported from other countries,
Yeah.
and they do sales.
Yeah, absolutely. I was about to ask the same thing because I've seen when I went for my dental treatment, right? The doctors saw it and they took sort of a dye They put a plaster and they actually took a dye and they sent it to a third party, a vendor who actually created the crowns and all that stuff, which will fit into my mouth, and then they do it. So yeah, there is a third party involved. I have seen it, and they gave me a couple of options of what kind of
What type of
treatment.
crowns you can have
Yeah,
with.
a lot of things, and it's a lucrative business because the grades that I have seen are going from normal to very expensive as well. So it's a big business, and the
The world
chair.
is very small. The world is very, very small. We get all international products right now sitting in the any village. We can achieve anything. The US
Okay,
brands and Japanese brands we have at in our hands. Even not just, degrading our Indian products, but we have a wide range of products.
correct.
And as a lab persons, they doesn't have to work for one clinic. They can work
Mm.
for across the country also. They work.
Awesome, awesome, awesome. So, Dr. Vasant, when we talk about all this, the equipment that you said, right, the chair and all, so there are technicians who I mean, who maintain it.
Yes.
There are people who sell it as a product to you. Um,
Yes.
so
There
that's
are
also scope.
yes, dental technicians are there. They
Mm,
starting from the tiny instruments that we use it, not drill what we use it,
mm,
starting from that handling and servicing it and repairing all those things, and to the maximum of microscope, laser, all those things. There are so many wide range of equipments we use it. Without equipment, there is no dentist actually.
yeah.
We cannot survey because it needs a lot of diagnostic as well as a treatment process. So all those equipments need a maintenance and service team definitely.
Yeah.
They are not associated directly with the clinic. We hire persons whenever required.
Okay. Okay. Awesome.
They will
And
be actually busy than us.
great, great. So students who are listening to this, right? BDS and then all the ecosystem around it. If you are not, able to crack the need, there are options where you can do the diploma courses that surround the dental world, and you can be a professional. You can make a good amount of money as an income coming from it, and there is a huge network. You can always be part of that network in this dental environment. This gives a lot of potential, so don't give up on looking at only the top things, but there is an entire ecosystem. India is growing, so a lot of people. We are the most populous nation, 1.4 billion last count. It might be 1.5 now, who knows. So many teeth you need to treat, including yourself. So there
Yes,
is, the potential is enormous. uh, and this is what we want you to understand. Now, the reason we are bringing experts like Dr. Vasant is for you to understand what it takes to get into that profession. What is the future look like? What are the other, if you don't get to the top, what are the other subsidiary professions that you can achieve, so that you are making uh, impression, you are serving as well as you are becoming a professional, right? So just make sure that you are connected. Watch these channels for your passion, whatever takes it to you, to your dream goal. Try to achieve it. If you are not able to crack NEET, that's fine. You have a plan B, do a diploma, or get into you start up your own company which deals with these accessories. So there is a lot of potential. And with this, I would like to thank Dr. Vasant for his time, his for taking out from his busy schedule. I am sure that he must have missed 10 calls by now.
no, not at all, not at all. Thank you, Ganesh
Yeah,
for your
yeah, yeah, yeah. Will
patient listening to my things, and thank you, students, for listening patiently for my views and things. And
yeah.
all the best, everyone.
Yep. Thank
Keep
you.
rocking.
This is required. It's required. So we'll catch up again with another session very soon. So thanks, Vasant. We'll connect again. We will share the details of how to connect with the experts that we bring into these talks in under the YouTube video. When we upload this video, please do comment and ask a question so these experts can reply back to you. Okay, with that, I will sign off. Thank you, Vasant, again. We'll catch up
Thank you.
with soon.
Thank you,
Yeah,
Ganesh.
bye.